Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com, you will find the show notes, 11 free tips as a PDF, and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Welcome to episode number 39, Making the Most of Precision Medicine for MS Patients. Insights and Perspectives with Dr. Barry Singer. Dr. Barry Singer is the director of the MS Center for Innovations in Care at the Missouri Baptist Medical Center, and he is a host of the MS Living Well podcast. And he is placed in St. Louis, Missouri in the United States. And now the interview begins. Hello, Barry. It's a pleasure to have you on the show and a warm welcome to St. Louis in the United States.
Well, thank you, Nele. Thank you very much for having me on your podcast.
And before we start with the podcast, it would be lovely if you could introduce yourself to the audience, to the few ones who don't know you yet.
So I am a director of an MS center here in St. Louis, in the heartland of the United States, right in the center. And I run a comprehensive MS center. So we take care of over 4,000 patients at our center, and do it with a whole team of wonderful nurses and medical assistants. And in addition, we do a lot of clinical research. So we've been involved in numerous clinical trials, bringing some of the medications that we have available to the market, and research on remyelination. So very exciting research as well. And, in my spare time, I have a website, MS Living Well, that was started in 2008, which provides comprehensive education for people living with MS around the globe. And then also MS Living Well podcast for the past 5 years. So keeps me busy.
Absolutely. And it's a really a great podcast. So I can just emphasize to it's really worth hearing into it. It's a great one. But let's talk about the current treatment landscape for MS. What are the currently the most important treatment approaches for multiple sclerosis patients?
Well, there's been a paradigm shift. I think, for a long time, we started with maybe some of the safer medications that have been around for a long time and then escalate. So if you're not doing well, you have some breakthrough disease and you go to a drug that maybe have a little more risk, but potentially getting better disease control. And what we find now when we have so many highly efficacious medications out there is that we can start with highly effective drug and prevent a lot of the disability so that people can live their best lives without disability. So in the United States, what that means is we're using a lot of monoclonal antibody treatment. And so we have approximately about 40% of people in the U.S. are taking B cell depleting medications. So we see a tremendous amount of patients that are on these medications that kind of prevent recurrent relapses, new MRI activity. So I think that's the real shift. We're really just kind of pouncing on the treatment of the disease from the very beginning to really change the disease course for people living with MS.
Yeah, absolutely. And I just saw numbers. We had here the Advanced Symposium by Tjalf, and he showed some numbers from Germany, the treatments we are starting off with, and I think it's just something like 20% monoclonal antibodies, and you start off with more than 50% or something like that. I don't remember the numbers correctly. Maybe you can correct me there, but at least we are going in the same direction. We are just starting at a much lower level with the highly effective therapies at the beginning.
Yeah, I think, one of the exciting things is you can see if you get started on a very effective medication early on, you just prevent having relapse after relapse and significant disability. Many of our medications now, like some of these highly effective drugs, are equivalent to having one relapse every 10 years, which is like amazing. Back in the day, I've been around for a long time in the world of MS, and we had only the injectable medications, the interferons and glutathione acetate, and people would sometimes have a relapse every couple of years on those medications and end up with significant disability later in life. And the poor people that, before we even had it available, the people in their 70s, some of these people were just really beaten up by MS. And so I can already see it. Each generation does much better than the generation before because of the therapeutic breakthroughs.
Yeah, absolutely. And one of your topics you are concentrating on is personalized treatment for multiple sclerosis. Can you explain the role of precision medicine in the individualized treatment of MS patients?
Yeah, so when we think about personalized treatment, we're really trying to match the right treatment for the right patient. And so we have a whole array of treatment options out there. So in the United States, we have over 20 FDA-approved treatments. So it's really trying to pick the right treatment for the right individual. And so personalized treatment really allows us to individualize matching the right treatment for the right patient. When we think about precision medicine, it's kind of the same thing as personalized, but I kind of like the term personalized better because we don't have all the biomarkers, all the tools to definitely know this is the right treatment for the right patient, but there are a lot of factors that help us tailor that decision.
Fantastic. How do you create personalized treatment plans for your patients and monitor their success?
So one of the things that we need to do is, first of all, look at the disease activity in the individual that we're working with. So if a patient comes in and they have highly active disease, a number of active lesions on the brain, a number of spinal cord lesions, we know we're going to need to take a medication that has higher power to control that person's individual disease. So that becomes very important that we match the right treatment to the amount of disease. Some people, on the other hand, may only have 2 or 3 small little spots in the brain and positive spinal fluid, and they have very mild disease. So they may not necessarily need a medication that depletes part of their immune system long term. So I think part of it is understanding the amount of disease, and that means looking at the spinal cord and the brain. The other thing that we look at are there's certain risk factors for worse prognosis. So incomplete recovery from the first attack. So let's say you had visual loss out of one eye and your vision never recovered completely. That would be an issue. The other things that we look for are men tend to do worse. And so men who are people that are older at the onset of the disease, like people age 40 and over, have a higher risk of progressive disability. So we want to look at those demographic features, the features of the individual, to make sure that we're matching the treatment to their disease. Another important... Oh, go ahead.
No, yeah, absolutely. And they were talking about it at ECTRIMS, that it's really important to see when the immune system is changing, that you are balancing it with the right medication, right?
Right. So you got to pick the right amount of power for the disease. And then we really have to start tailoring our treatment to that individual. And so we have to look at a number of factors. One of the things that very, very important is looking at other medical problems. And so that will help us make a decision. So, for example, many of our people living with multiple sclerosis have other autoimmune diseases. So they may have rheumatoid arthritis. They may have inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, psoriasis. And so some of our medications may help both. We have some medications, for example, in the United States, we have ozanimod, which is approved for ulcerative colitis and for multiple sclerosis. And dimethylfumarate, for example, was actually used for psoriasis in Germany before being used in the world of MS. So a lot of times that becomes important. We also have to look at, precision medicine or personalized medicine also has to look in the account if you have a history of cancer. many patients over time develop cancer, whether it be breast cancer, skin cancer. So trying to pick the right medication for that individual is important. Some of our medications have been associated maybe potentially with a higher risk of certain types of cancer. So we have to really look at that individual. The other thing is some of our medications, for example, teriflunomide, S1P medications, can sometimes increase blood pressure. And so we also want to keep that in mind while we're picking a medication for someone with hypertension. And the S1P medications like fingolimod can sometimes cause macular edema, particularly in patients with diabetes or uveitis. So again, these are some medical conditions that help navigate one way or another with medications.
Okay, great. And of course, you now mentioned already some other diseases, but I guess you are also using certain type of biomarkers, certain test results. Could you maybe dive more a bit into that topic?
Yes, Nela. So when we think about biomarkers, it's basically a blood test to monitor disease. So when you think about people with diabetes, you can measure hemoglobin A1C. Or if you have monitoring cholesterol levels, you can check that in a blood test. So we're now doing blood tests to look at multiple sclerosis disease activity. And we have one test that I've been using in the clinic for the past year is from a company called Octave. And what we do is look at a panel of biomarkers, blood tests. Some include something called neurofilament light. Neurofilament lights and neurons. And when neurons are damaged, this goes up in the spinal fluid and also up in the blood, and we can actually measure it. So it's damage to the nervous system. And then we also have biomarkers that look at inflammation, biomarkers that look at myelin, the coating of the nerves, and look for damage there. So we can use these panels that are associated with a risk of having increased disease activity. So let's say I put someone on a medication. It's moderately effective, not the most effective medications, but good safety profile. And then I could do a blood test on a patient and then find out if they're at high risk for new activity or they're doing well in that treatment. Some people don't want to go on MS treatments. They just say, I'm not going to do it. I'm going to do diet, exercise. I'm not going to take a medication. But if I do a blood test and it comes back high, maybe they might engage that conversation, or someone later in life who says, do I really need this medication? So we're starting to implement it. It's definitely approved and available in the United States, but it's a learning curve, but we're starting to implement it. I do see very high levels in patients that do have very high activity at baseline and before they start their disease-modifying therapy. And so then once we initiate the DMT, the disease-modifying therapy, we can see how well they respond on the biomarker testing.
Fantastic. And to what extent can predictive models help to determine the most effective treatment strategies for individual MS patients? And what are the current limitations, as I guess we are not yet there fully, aren't we?
Yeah, I don't think we're there yet. So I wish I had a nice predictive model where I can put in some information and get that info. Actually, I had Professor Jeff Simpson, Dr. Simpson on my podcast talking about digital health. And he talked about a digital twin. So we could actually create a digital twin, and then we could do an analysis on that. And so kind of predicting how someone would do and which disease-modifying therapy would give that person the best option of doing well long-term. So we're not quite there yet. Hopefully some artificial intelligence will help in that endeavor, that we'll be able to analyze how other people have done globally on the various disease-modifying therapies to help guide our decision-making.
Yes, the digital twin is really a very interesting concept, and I'm really looking forward when this is all in place and working. Can you share maybe a success story where precision medicine has significantly influenced the outcome of an MS patient?
Yeah, so, well, in the United States, we've got a lot of privacy laws, but I can talk about some of our positive outcomes. I mean, I think where it really comes in handy is if you have patients that have been on a disease-modifying therapy, not doing well, and how do you get to the next next agent? Where do you go? And so I think this really becomes part of the comprehensive care. I think it also helps if you have an MS specialist in your with you in this journey to try to make the right decisions. But sitting down and really analyzing, what medications they've taken before, what kind of response that they had, and if they weren't doing well, why weren't they doing well? Is it new active enhancing lesions? Is it slow progression over time? And then trying to figure out which medication has a strong chance of changing that disease course. Some of our medications have shown some benefit in progressive disease. We need better medications for progressive disease, but some have shown some benefit. And so if a patient's going down that trajectory, then we may want to use a medication along that lines. If someone's having worsening cognition, we have some medications that have some data that support trying to prevent cognitive decline. And then again, we have to look at the patient's medical history, what kind of medical problems they have, how the medication's given. Some patients are very adherent to their medications and some people aren't. I just had someone in yesterday, a terrible relapse because they were not taking their medication regularly as recommended. And so we have to find something that the patient feels comfortable with, that can take it, and is able to, we call it here, stick with the plan over time.
Yeah, absolutely. And you already mentioned the progressive MS patients. So to what extent do these patients also benefit from the possibilities of precision medicine, as long as we don't have really highly effective medications to stop the progression?
Yeah, I think the best way to prevent progression is by preventing the disease up front. And so I think if we can really get on top of relapsing MS early in the disease course, we're going to prevent more and more patients from becoming secondary progressive. And we've seen that over time with the implementation of disease-modifying therapies. The time to secondary progressive has been delayed. And we're trying to prevent more and more people from becoming progressive. But we do need new medications. So precision medicine or personalized medicine can say, okay, you got progressive disease. Let's try to pick a therapy that's going to work best for you. But unfortunately, we don't have enough tools or medications that really slow down slowly progressive disease. And so hopefully we'll have more of those. I've been involved in clinical trials in this front, and we're hoping that there will be a new generation of medications that will work in progressive MS.
Fantastic. And I know you are really everywhere. I saw some posts on LinkedIn that you've been to China, for example, to help MS specialists there, or maybe people who want to become specialists. I'm not pretty sure about that. What do you think? Which MS patients currently have access to precision medicine, even maybe on a global spectrum, but of course more dedicated to the United States? And how do you see it developing over the next 5 to 10 years?
Yeah, I think there's been definitely a push for global access to disease-modifying therapies. And clearly there's inequality and inequities out there in the world in terms of access to DMT. We did see the World Health Organization put 3 disease-modifying therapies on their list of essential medications. And I think that's really critical that we have access for patients living around the world with multiple sclerosis. And we know it's a global disease. And so to do personalized medicine, you need options. And so we definitely need about access and ways that we can get medications to patients. Now, some have gone generic, so the price has decreased. But actually, in some countries, the generics aren't even available. And so we really have to get the medication available out there. And then when you have options, that's when the personalized medicine can come into play, where we can really start looking at different groups of patients and figuring out what responds. And it may not be the same. A lot of our studies, you have to be careful. Some of our studies have actually been done in some trials all in Europe, and it's frankly in Eastern Europe, where access to disease-modifying therapies may not be as good. And people are willing to enroll in a clinical trial where you have access to medication. And so we want to look at all different type of populations, like you mentioned the Chinese, how does it respond in Asian populations, medications. So a precision medicine may be different for someone with a different ethnic background, different genetic background.
Yeah, absolutely. Let's come to patient involvement. How do you involve patients in decision-making regarding their treatment plans?
So that's really critical, Naila. I mean, we really want patients involved in the process of selecting a disease-modifying therapy and, kind of it's your brain, it's your spinal cord. Let's get you involved. And we call it shared decision-making. So it's, I think in traditional medicine, the doctor says, this is what you should be on and writes the script and hands it to you. But a lot of times the patients never fill that script, especially if they didn't have a good relationship with the provider, the neurologist. And so what I like to do is sit down and go through someone's history, their story, do an examination, look at their MRI together. We look at the pictures so they understand what we're trying to prevent, lesions in the brain, lesions in the spinal cord, prevent brain shrinkage over time. And once they get on board, then it's about sitting down and talking about treatments. So, obviously, if you're an MS specialist, you've been doing this for a lot of years and you understand the pros and cons and nuances of what might be appropriate for an individual patient. But then I like to circle back with maybe 2 or 3 options that I think might be appropriate, and then go through the pros and cons of these medications. What are the benefits? What are the serious risks? What about day-to-day side effects? How's the medication given? And so it's really great to sit down and talk about all the nuances of the medication, and then we try to make a decision together. Sometimes, someone's not ready to make a decision right there on the spot, and they may take some literature home, or I give them information from my MS Living Well website, which has all the different therapies, and they can kind of read about them. So that can be really, really great. There is also the Ultimate Treatment Guide through the Multiple Sclerosis Association of America, which has good online resources where you can compare medications and see videos of neurologists talking about the medications as well as people that are taking them. So I think sometimes that helps. But I think it really should be part of that discussion. I think if you are helping to decide on the treatment, I think you're going to be much more likely to not only stick with the medication, take the medication regularly, but also get the blood tests that are important to monitor the safety or what other safety testing needs to be done. You'll understand why we're doing this.
Absolutely. I always sat together with my neurologist and he explained me why the type of medication I'm taking is good for me and why it is working. And that's why I have really a high therapy adherence and was maybe just for my birthday or so not taking the daily medication. As you said, it's my life, it's my brain and my spinal cord, and I have to take care of it. And he is the expert who can give me in-depth knowledge and provide me with his expert view and recommendation.
Well, it's very, very important. You can't personalize treatment unless you understand, you get feedback from the patient. So when we have follow-up appointments, that's what the importance of follow-up appointments are. How's it going? How are you doing with your medication? Are you having day-to-day side effects? Are you having diarrhea? Are you having hair thinning? Are you having, what are the side effects that you're having with the medication? Then we talk about, ways to manage it. We did this a lot back in the day with interferon, which had flu-like symptoms and achiness. Some people have injection site reactions. So ways to kind of tweak the side effects are important. But if it's intolerable and, you're miserable on the medication, there's no point in continuing. We have lots of different options. So I think that's part of the process is really listening. And then we also have to, clearly monitor the disease. So if you have new MRI activity, you're having cognitive worsening. One of the things I do in my exam rooms on a regular basis is I have an iPad and it's a cognitive testing. And you match symbols with numbers on an iPad. Just takes a couple minutes to perform. And then I can find out how you're doing compared to other people your same age, same educational background. and without MS, and then can monitor that over time. And if you're losing ground, then we start to worry. Maybe we need to switch things up. So it's another way of personalizing treatment.
Absolutely. And I'm doing this in my MS center as well. And I'm also doing brain training, neuronation. I don't know if it's international already, but they started it in
Sounds good. Brain training
Germany.
is the way to go.
Yes, and it's fun. I mean, they made it really playful, so that's a good thing. How do you educate MS patients about precision medicine and its potential impact on their treatment?
Yeah, so I think it's really about when I talk to patients, it's not as much about precision medicine as really about personalizing their care. And so it's really about diving into understanding who they are as an individual. What are their goals? What are their aspirations? How much risk are they willing to accept to achieve those goals? Some people don't like medications with serious risk. That makes them very anxious. And so, but kind of explaining how we can control your disease and what the best approach is, I think, is very, very important. So it's an ongoing conversation with the patients to understand that we are trying to achieve the best outcomes. And so they understand like why I'm doing the cognitive testing, why we're doing biomarker testing, and what we're trying to achieve.
Yeah, very good. So you already mentioned now that you are involved in a couple of trials. So are there promising new therapies or treatments for multiple sclerosis on the horizon?
Yeah, so the biggest class of medications that we're kind of excited about is BTK inhibitors. And so there's some clinical research going on for this. We actually just got the top-line results on evobrutinib, which ended up having about the same annualized relapse rate, the same rate as teriflunomide, also known as Aubagio. And so the first one that came out, at least in relapsing MS, looked about the same as teriflunomide. Frankly, the patients had very few relapses on both treatment. So it was equivalent about one relapse every 7 to 9 years. So the annualized relapse rate was very low, somewhere between 0.11 and 0.15 in the two trials. So there was a very low amount of relapses. And but the big question is really, can it slow down the progression? And so I think that's the bigger question, and that's still pending. And so hopefully this class of medication did work in progressive MS, because that's really the unmet need. And the reason is because these medications affect a cell, not only B cells, like many of our MS medications, but also affects a cell called microglia that are in the brain and seem to be driving chronic inflammation in the nervous system.
Okay, so do you have an idea when these, let's say, more in-depth knowledge will be shared with the audience? Will it take like 2 more years, 3 more years, 4 more years, when they can really say something about the neurodegeneration?
Well, I think we may have some more data on progressive MS, hopefully later this year. I think we should have, hopefully by the end of this year, we'll have some more information.
That sounds good. Great.
We need more options.
Absolutely. And I think, for relapsing remitting, we have already quite some options. If it would really target the chronic inflammation, that would be great. And that's what I hope for. And I think many other people. What breakthroughs or advances do you hope to see besides the BTK inhibitors?
I really would like a remyelinating compound. So I've done 5 clinical trials at my center on remyelination, including phase 1 and phase 2 clinical trials. And so that's what I really like. I got a lot of patients that I like to fix, a lot of long-term patients that, some of my patients I've known, frankly, for 24 years. And so there are many patients that I would like to improve their quality of life and or at least prevent the disease from getting worse. And so we really need remyelinating compounds. I've done some trials with antibody therapies, but antibodies don't tend to get, these monoclonal antibodies tend not to get into the brain and spinal cord. They tend not to get across the blood-brain barrier, we call it, the membrane, to get into the nervous system well, and not in high concentration. So we may need an a compound that can, like a small molecule that can get into the brain and spinal cord and turn on remyelination. We know about 5 to 8% of the cells in the nervous system are immature myelin-making cells called oligos. They're oligo precursor cells. And these cells are just hanging out. And so I'd like to turn them on and start making some new myelin. So anybody out there listening who's got a myelin compound that wants to bring in a clinical trial, I got plenty of patients ready to go.
Yes, it would be so lovely. I had some interview guests here who are working on this topic. Would be such a great thing to see. And as you are in the US, I mean, there are sometimes very far away distances. I mean, my cousin lives in Texas, and when she sees her parents-in-law, it's like 9-hour drive. So telemedicine is something interesting. Not so much in Germany, but there are lots of countries out there where telemedicine is something interesting. How has telemedicine and remote monitoring for MS patients evolved in the context of precision medicine?
Yeah, so I think it has really changed the landscape, particularly with COVID-19. So COVID-19 really just blew it up because for a while, there was a period of time where we were only virtual because we were so afraid of our patients contracting the virus and being immunosuppressed. So it's definitely come a long way. So we use telemedicine on a regular basis. Now, I think most people would rather just come into the office and be examined thoroughly. But, I do have a lot of patients that live far away. We are in the central part of the United States and, out here in the heartland. Many of my patients drive 4 hours one way for an appointment. So they'll come in, be seen, and 30 minutes later, they're back driving home. So it's a long way to go to see a specialist. And so sometimes every other appointment we'll do it virtually. To make it more convenient, particularly people that are fairly stable in terms of their disease and, their exam's been pretty stable, then that's a way of doing it. I think it also, a lot of rural patients, unfortunately get undertreated in the United States. And so, they may have a local neurologist who does everything, a general neurologist, and it's hard to stay up on MS with, how can you do precision medicine when there's 20 treatments and you're taking care of every neurologic disease? It's an overwhelming amount of information to stay up on all the MS treatments as well. So, a lot of the general neurologists tend to fall back on, the few medications that they tend to use the most and are more comfortable with. So what telemedicine allows us to do is connect some of these patients to an MS center where we can really give them that personalized approach to picking disease-modifying therapy to match their disease.
Yeah, and it's the same issue here in Germany, even so we are not such a widespread country. But yeah, when you are somewhere in a rural area, you go to a normal neurologist, and of course they take care a lot of stroke patients or dementia or all that. That's an issue. What opportunities and challenges do you see in the area of telemedicine?
One of the issues that we have in the United States is you got to be licensed by state. So during the pandemic, there was some emergency authorization. So I actually had ability to see my patients virtually. They're in California. I have patients actually all over the country, and some people fly in for appointments. And so we were able to do a lot of this stuff virtually. But now that's kind of shut down. So I'm in the process of getting a state license for Illinois. I'm in Missouri. And so you have to kind of go through this whole formal process to get licensure across state lines in the United States. So I think that's a limitation. The exam is a little bit of a limitation as well. It's hard to check reflexes over the internet. I have been able to do, quite a few interesting exams. I have patients put their phone against the floor against the wall, so I can see people walk, and they can do heel to shin and finger to nose testing. And, so I've figured out creative ways to get a lot of information from the exam virtually, but it's not the same thing as being able to really check someone out to see if their legs have gotten weaker over time.
Yeah, but it's already lots of creativity, so that's good. And I was at the same neurologist since end of 2008, and I moved here last year. So from 2008 until 2022, I was going at least 200 kilometers, which is not much in United States distance proportions, but yeah. That's, I think if you have a good specialist, it's totally worth it going there. And for some people, it's nice if you can every now and then do something.
I think virtually, the one interesting thing is, you can definitely look at the MRIs as the same. The conversation is the same. We can manage a lot of symptoms of MS as really a discussion more than anything else in terms of how you're going to manage fatigue and bladder dysfunction and nerve pain. So some of this you don't really need to be in person to do some of this. And some people it's more comfortable to be at home. You actually get a little insight. Some of my patients are, you see a cow in their backyard and other people are in, more urban situation with lots of family in a very small apartment. And so you get to see, some of the natural environment. It gives you a little more context to understand how their patient's doing in their journey with MS.
Yep, it's also good. You mentioned it already, but how and where can interested people find you online? You have quite some possibilities to get information that was prepared by you and your team.
Yeah, so definitely, if you are interested, check out the MS Living Well podcast. So it's on various podcast apps, including Apple Podcast. I'm also, the website is mslivingwell.org. And so a lot of great information there. There's a blog, there's information on understanding your disease. I got animated videos, understanding your MRI, and some award-winning content there. And then I'm on Twitter, or X, I guess it's called now. And so, I post there as well, particularly like during the meetings, the academic meetings, like ACTRIMS, and try to post the latest news. So if something new is going on in the world of MS, I put it out there, and I announce my podcasts on there as well.
Fantastic. Yes. And I will link all of these in the show notes. And I met you at ACTRIMS in Milan. Next year, I don't know, because I am pregnant as of now. So I don't know. It will be half a year old. So probably I won't join Copenhagen, but let's see.
Maybe virtually.
Maybe for joy, and maybe I will go to a few sessions if the baby is lovely and friendly and sleeps a lot. But yeah, Barry, thank you very much. Thank you very much for everything you do. Thank you very much for taking your time for the interview. It was a pleasure, and I will check out on all your information, and I think it will be very interesting to lots of the listeners. And yeah, thanks.
All right. Thank you, Nela, for the opportunity to be on the podcast.
Bye-bye.
Bye-bye.
I hope you enjoyed the interview and learned quite something new. I did, and I think it's so great that we have more and more this precision medicine, and that medicine is more and more tailored to the needs of each individual patient. By the way, next time I'm talking to Dr. Roland Martin about the autologous stem cell therapy, or for short AHSCT in MS, about his facts and experiences. So please tune in again, and hear you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. Hear you next time.